Hi guys, welcome back to another video of Eduate channel. So today we will be dealing about the theoretical basis of Polioencephalo Malacia, that is PEM. So moving to the definition part, this is actually a deficiency disease or deficiency disorder. So it's better to call it a disorder. It's a deficiency disorder of mainly ruminants, which presents with clinical signs associated with neural problems and staggering gait. So if at all there is this disorder, we can mainly see clinical signs associated with neural problems and staggering gait. So moving to the etiology, this is actually due to deficiency of vitamin B1, that is thiamine, vitamin B1 deficiency disorder. So how come vitamin B1 deficiency occurs? That is bracken fern poisoning. We are all familiar with bracken fern, and why is it such that? Because there is excess thymidase activity in bracken fern. So these thymine will be broken into byproducts. So there will be less thymine. So post-ruminal acidosis. Actually, there are many bacteria which are very essential to produce proper amount of thymine from the rumen. So whenever there is ruminal acidosis, many bacteria dies and the microflora get destructed. So that leads to destruction of microflora and lesser production of thymine. Next is amprolium, which is also having same antagonistic activity against thymine. Also decreased feed intake, high concentrate and low forage feeding, high sulfur in diet. So these are some common reasons behind thymine deficiency. So moving to the pathogenesis, how come thymine deficiency leads to neural problems? This is actually the basic theoretical thing in this PEM. So in ruminants, a great source of energy is actually from the pentose phosphate pathway, which is also called as PPP pathway or PP pathway. For pentose phosphate pathway, an enzyme which is very much active, that is RBC transketolase enzyme, which is actually very necessary for PPP to happen. So for that enzyme, actually thymine is a cofactor. So whenever there is very less thymine, there is very less activity of RBC transketolase. So there is less ATP in brain. So what happens? Water comes into the brain cells and the brain interstitial space. That leads to edema and elevation in intracranial pressure. That leads to degeneration and necrosis of brain tissue. Thus, it is also called as cerebrocorticonecrosis or CCN. So moving to the clinical signs, that is blindness due to pressure on optic nerve. Nystagmus, that is actually also due to the problems associated with optic nerve due to the pressure. And dorsomedial strabismus, other neurological signs, opisthotonus, hyperexcitation and circling. So moving to the diagnosis actually tentative diagnosis that is based on history and clinical science. So next is feeding schedule. Wherever we can ask like where there is any history of feeding of rice or excess carbohydrate, we can go for this ruminal acidosis ruling out, or we can ask for any bracken fern excess eating, or we can go for any usage of amprolium to prevent this coccidia and all. Next, we can go for blood analysis, that is blood thymine level, and also we can go for cerebrospinal fluid pressure, CSF pressure, and we can also check cerebral edema. So moving to the treatment part, which is actually injection thymine hydrochloride 10 mg per kg body weight IV, and orally we can go for 1 gram per day per god. Mannitol to relieve the brain edema, corticosteroids, that is dexamethasone, which is very important in case of PEM, proper bedding, supportive fluid therapy, and in last, we can go for euthanasia if there is no response. So you can see this is actually thiamine hydrochloride injection. This is mannitol injection, which is actually to relieve the brain edema. So this is dexamethasone injection, which is actually a corticosteroid that will reduce the excess inflammatory activities in the brain. So this is actually the vitamin B1 powder, pure vitamin B1 powder. This is actually the Brackenford. And this is the amprolium powder which will act against coccidia but will also act against thiamine. Okay, thank you.